contact tracing is basically going back and trying to find the original source of the disease or how the disease is spreading. And so the father of epidemiology, his name is John Snow, not Game of Thrones John Snow, but the actual John Snow. And he investigated dysentery, which is a disease that often results in diarrhea, from the Broad Street pump. And basically the water coming out of that pump was infected with a bacteria and it was infecting people. So how he did it is he made a map and noticed how many people were using water from that pump, and he was able to identify the source. Well, in this case, we're going to be working the opposite direction. We already know the source, the person who is infected or has COVID-19, and so we want to find out how many other people that they've come into contact with and that they've infected. Okay, so in this picture, we're going to pretend that these are all people, right? And they're social distancing. See how they're all nicely far apart. But this person right here, even though they're out here with all these people, they actually have COVID-19. So this yellow person right here. And this yellow person right here, they have COVID-19, but they're asymptomatic, which means that they don't know that they have it yet because they are not experiencing any symptoms. They don't feel sick. So we'll pretend that this was just this past weekend. We had a holiday weekend. And so this person with COVID-19, they're all out in the community, you know, with all these people. These people aren't sick, and this person is, and they're having a great old time. Then this person decides that they're going to go to the lake and they're going to party it up and have a good time because, you know, we've been having stay-at-home orders and they need to get out and they need to see people. So they go out and they see all these people, and these are all the people they came in contact with, all of these people. And one of these people has COVID-19, and they don't know it yet because they're asymptomatic, or maybe they are symptomatic and they're in denial that they're sick, because I'm sure we've all been there where we don't want to admit that we're sick and we are. And so they decide to go out, and then they get sick, and so they have to tell people who all they came in contact with. So that's when we get what we call disease detectives or contact tracers. So they're going to investigate that person who is sick. So it's not like a criminal investigation or anything. It's just, we just want to know who all they came in contact with, so we can find out who else might be sick too, who else might have gotten the disease. And when somebody has COVID-19, they can infect up to 2 to 3 people. So then those 2 to 3 people can infect 2 to 3 people themselves. So you can kind of see why, if we can limit the number of people they infect, then we can reduce the infectious rate. The rate of transmission is what we call it. So if we can limit the number of people who are infected, we can limit the number of future people who are infected. So we're going to investigate that. We're going to call them and say, hey, we noticed you had a positive test. Let's say they went to the doctor yesterday, you had a positive COVID-19 test. What all have you been doing? When did you first start feeling sick? Who have you been in contact with? Just stuff like that, like simple questions. It's not accusatory or to make somebody feel guilty, just to find out, you know, like, hey, who else might you know? And then we're going to contact the other people. So here are all the other people again. And we're going to ask them how they're feeling, if they're sick or they've been feeling sick. And these 3 people actually, with the arrows, this person here, this person here, this person here, they actually are sick. They've been having symptoms themselves. And they came in contact with a person. And so they're going to have to be isolated, the same as the individual who has COVID-19. So one way to remember that about being isolated is isolated starts with I, and that means you're sick. So you have to stay home by yourself. And so be isolated. And then and until you're feeling better, until you're no longer sick. And then these other people who came in contact with the sick person, the contact tracers are going to contact them too to see if they're having symptoms. And if they're not having symptoms, they're going to be asked to quarantine. And that basically means that they need to stay home for 14 days. And in those 14 days, we're going to wait to see if they develop symptoms, because that's the incubation period. So the incubation period is the amount of time that the virus can live in your body before you start getting sick. So these people are all going to be asked to quarantine. And then we're probably going to ask the public health people, contact tracers, are going to ask these individuals too, who they might have come in contact with the 2 days before they started feeling sick. Then that way we can see like how many people possibly were infected by that one person. And that's just to see how the disease is spreading in the population and how we can stop it from spreading. So that's a really high level description of contact tracing. Next time, I'm going to talk to you guys about clinical trials, because we've been really hearing a lot about drugs and vaccines and drug therapies in the news. And where we're at in most of those are clinical trials. And it's important to understand how clinical trials work and what that all means. So that's going to be next time.